From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
9 minutes now before 11 o'clock. It is the final day of June, and when it ends, so will National Cancer Survivors Month. Dr. Anna Gupta is the medical director at the Associates in Radiation Oncology, and she joins us from time to time here on Live This Morning. And she's here now with a couple of things to talk about, not the least of which is cancer survivorship itself, which is, and I said almost jokingly, it's not just a week, it requires a month because there are so many more. That's the cancer success story to talk about, is that cancer is a survivable disease in most cases now, as it turns out. But what that does too is it sort of sets up an ever-expanding group of cancer survivors, these people who have beaten the disease.
Correct.
Does it change their lives beyond just the fact that they had this terrible disease once and they're over it now? Are they always cancer survivors as it stands out?
Well, first of all, as an oncologist, I'd like to congratulate all the cancer survivors out there.
Absolutely. And
wish them, continued good health. So it's cancer's now becoming one of those diseases like heart disease, diabetes, even HIV, that is a chronic disease. It's something you live with, but not necessarily die of. And we have, with all sorts of advances in treatments available now, it's becoming, actually survivor issues are actually becoming a big problem. Side effects from therapies, how to manage them, quality of life issues, lifestyle issues, they're all becoming more of an issue as opposed to curing the disease.
It's a good dilemma to have, though, because they indicate that these patients are able to beat the cancer diagnosis and to live longer and much more fulfilling lives. But you do have to be realistic about this. If you are a cancer survivor,
right. So we don't talk so much, patients like to always ask what the prognosis is.
Yes.
And prognosis always becomes a difficult question to answer in this day and age, because we don't necessarily talk about cure issues anymore. We talk about long-term issues, so that you're never truly cured, whereas the disease may be in control, and you go on to live your life as long as you would have lived your life, to die of your heart disease or your whatever else you may have died of, and so you die with your cancer and not of your cancer.
I should think, too, that it is difficult for some of those patients, some of those survivors, to sort of get over the shadow that they think is somewhere over their shoulder, that I'm worried if I go back to the doctor at some point,
right,
they're going to find the disease has returned.
Yeah, and studies have repeatedly shown that follow-up is actually more anxiety-provoking than actual treatment issues, because you never know when that other shoe is going to drop. But frankly, even with what we call metastatic disease, meaning cancers that have spread from wherever it is they may have started, with targeted therapies, with the kind of technologies that are available, for example, in my office, there are all sorts of treatment modalities now out there that weren't there before. And I think we have to thank the thousands of men and women who enrolled on clinical studies, on research protocols that have allowed us to get to this point and given us all a promise for tomorrow.
We have in many ways in this country, and the fight against cancer was often described as a war on cancer. A lot of people mobilized for that war. Right. The people who were in those research protocols. There were cancer patient groups, a lot of support, that sort of thing. Yeah. Are there as many people on the other side of the disease, the survivors groups, who get together and sort of deal with their issues as well?
There are, of course. We've all seen the breast cancer walks. Those are all survivors, families of survivors.
Those are very high profile, though,
right.
but if you have pancreatic cancer or something like that, is it equally?
The less common diseases, no, they don't get the same kind of press. And frankly, prostate cancer tends to kill as many men every year as breast cancer kills women, and still doesn't get the same marches and protests.
Well, and we don't talk about it the way we should as well.
Right.
Women are much better about dealing with it.
But I think one thing that the public should focus on, there is one very simple way to eliminate a significant portion of malignancies, and that's to stop smoking. 170,000 cancer deaths per year are due purely to cigarette smoking and heavy alcohol consumption. So if we want to really eliminate cancers, that's one of the easiest ways to do it.
That's a huge step to take right there. And the other side of that, too, is regular medical care and good screening, because found early cancer, as we've seen, it becomes a very preventable thing in most cases.
Yeah, screening mammography and now breast MRIs have made significant advances in the treatment and early detection of breast cancer, one of the most common malignancies out there.
It's probably too bad that we're confronting cancer survivors on the very end of Cancer Survivor Month, but it is good to end the month on an upbeat story, and you brought us that.
And it is definitely a promise for all of us for tomorrow now.
Thank you very much, Dr. Gupta. Good to see you.
Good to see you again.